Welcome to the Vital Signpost. We are diving into the world of pituitary drugs today, medications that can have a really powerful impact on the body.
Yeah.
You've shared some materials about the pituitary gland and its hormones and the drugs that influence them, so we're going to unpack those key takeaways for you.
It's a fascinating area, I think, of pharmacology,
Oh, absolutely.
especially given the pituitary gland's kind of wide-reaching effects. Um, these drugs can play, a crucial role in managing various conditions, so really understanding how they work is so essential for safe and effective care as a nurse.
Absolutely.
Yeah.
Let's just start with the basics, talking about the pituitary gland itself.
Okay.
It's often called the master gland, but
Right.
it's actually more like a conductor, orchestrating that whole symphony of hormones. It regulates so many of our bodily functions, but it
Yeah.
doesn't work in isolation, right?
No.
The pituitary gland collaborates really closely with the hypothalamus to form what we call the neuroendocrine system.
Yeah, that's an important point. So think of the hypothalamus as the composer, right?
Okay.
Sending those signals to the pituitary gland, which is like the conductor, and then that directs the orchestra, which is all the various glands in the endocrine system.
Okay.
And just like an orchestra has different sections, the pituitary gland itself has two distinct parts.
Okay, so let's break those down.
Right.
We've got the anterior pituitary,
Right.
which is also known as the adenohypophysis, and then we have the posterior pituitary, or the neurohypophysis.
Yes.
They may share a name, but they have very distinct roles when it comes to hormone production.
Exactly. The anterior pituitary produces a variety of hormones, each with very specific targets and functions.
Okay.
So think of it as that more diverse section of the orchestra, the one that's responsible for a wide range of melodies.
So what are some of those key hormones produced by the anterior pituitary, and what are they doing?
Well, we've got adrenocorticotropic hormone, or ACTH.
Right.
That's the one that stimulates the adrenal glands to make cortisol. Right.
And cortisol is essential for our stress response.
Right.
And it helps to regulate our metabolism.
Right.
Then we have follicle-stimulating hormone, or FSH.
Right.
And luteinizing hormone, or LH. These hormones are key players in the reproductive system. They influence the production of sex hormones and the development of eggs and sperm.
Okay.
And of course, there's growth hormone, or GH,
Right.
which, as the name suggests, plays a crucial role in growth and development, particularly in children.
That's already quite a lineup. And what about prolactin and thyroid-stimulating hormone?
Ah, yes. Prolactin stimulates milk production after childbirth,
Okay.
and it plays a role in reproductive health. And then we have thyroid-stimulating hormone, or TSH.
Right.
And that directs the thyroid gland to produce thyroid hormones. And those are really important, those thyroid hormones, for regulating metabolism, energy levels, and even heart rate. It's important to remember that these hormones don't act independently, right?
Right.
They work together in a really delicate balance.
Absolutely. And it's all influenced by this fascinating mechanism called negative feedback loops.
Yeah, that's a concept that I think a lot of people maybe find a little bit confusing. So can you explain those negative feedback loops in a way that's kind of easy to understand?
Sure. So imagine a thermostat in a house. When the temperature drops, the thermostat senses this change,
Yeah.
and it signals for the heating system to turn on, right?
Right.
Once the desired temperature is reached, the thermostat then tells that system to shut off, right? So it's this constant adjustment to maintain a nice, stable temperature. Hormone regulation works in a very similar way. So if a particular hormone level gets too high,
Okay.
the pituitary gland receives a signal to decrease its production.
It's okay.
And if the level drops too low, then the pituitary gland knows to increase production to kind of bring things back into balance. So it's this remarkable system that really ensures our bodies are functioning optimally.
Yeah. It's a beautiful analogy. Okay, now let's move on to the posterior pituitary. It seems to have a slightly smaller repertoire than its anterior counterpart.
Yeah, the posterior pituitary is primarily focused on two key hormones, antidiuretic hormone, also known as ADH, and then there's oxytocin.
Okay, so ADH, the antidiuretic hormone, it sounds like it's something to do with regulating fluid balance in the body.
You're exactly right. ADH helps the kidneys to conserve water, so it prevents excessive urination and dehydration. Think of it as the body's water conservation officer.
Interesting. And oxytocin, what's its claim to fame? Doesn't it play a role during childbirth?
Yes, oxytocin stimulates uterine contractions during labor.
Okay.
It also promotes milk ejection during breastfeeding, so it helps to create that beautiful bond between mother and child.
Wow.
It's often called the love hormone because it's also involved in social bonding and feelings of trust and connection.
Oh, I like that.
Yeah.
Okay, so we have this pituitary gland, the conductor, with its two sections, the anterior and posterior pituitary, producing this just fascinating array of hormones. But where do pituitary drugs fit into all of this? Where do they come in?
Okay, well, that's where things get really interesting from a pharmacological perspective. So, pituitary drugs either augment or antagonize the effects of naturally occurring pituitary hormones.
Okay.
Some of them, they act like replacements, right? They step in when the body isn't producing enough of a particular hormone,
Okay.
and then others actually block or reduce the effects of specific hormones.
Oh, interesting. It sounds like this delicate balancing act trying to restore the body's hormonal harmony.
Exactly.
So let's delve into some specific examples, and
Okay.
we'll start with cosyntropin. What can you tell us about this drug, and how is it used in a clinical setting?
So cosyntropin is a synthetic version of ACTH.
Okay.
You know, that hormone we discussed earlier that stimulates cortisol production.
Right.
It's primarily used as a diagnostic tool to assess adrenal function. So think of it as a detective. It helps us uncover that mystery of adrenal insufficiency, which is a condition where the adrenal glands aren't producing enough cortisol.
Okay, so cosyntropin is like a challenge test for the adrenal glands, helping us determine how well they respond.
Exactly. By administering cosyntropin, we can observe how the adrenal glands react and kind of get these valuable clues about their ability to produce cortisol.
That's a clever way to put it. Now let's move on to a drug that sounds a bit more familiar, at least in name.
Yeah.
Somatropin. It has something to do with growth, right?
You're on the right track. Somatropin is a synthetic form of growth hormone.
Okay.
It's used to treat growth hormone deficiency in children who aren't growing at the expected rate, so it's essentially giving them a boost
Wow.
to help them reach their full growth potential.
So it sounds like a beacon of hope for those families that are concerned about their child's growth.
Exactly.
But what about situations where there's too much growth hormone? Is there a medication that can help manage that?
Absolutely. That's where octreotide comes into play. It acts as a growth hormone antagonist,
Okay.
meaning it blocks the effects of growth hormone. It's often used to treat acromegaly, a condition where excessive growth hormone leads to abnormal enlargement of bones and tissues.
So octreotide essentially puts the brakes on that runaway growth hormone.
Exactly.
Okay. Now we've talked about drugs that mimic and antagonize those hormones from the anterior pituitary.
Yeah.
But what about the posterior pituitary? What are some key drugs in that category?
Okay, well, two important ones to know are vasopressin and desmopressin. They're synthetic forms of antidiuretic hormone, or ADH.
Okay.
That hormone that we discussed earlier that helps to regulate water balance.
So they essentially enhance the body's ability to conserve water.
Exactly. And that makes them incredibly useful in treating conditions like diabetes insipidus,
Right.
where the body just struggles to conserve water, leading to, excessive urination and thirst. They're also used to manage certain types of bleeding because they can actually constrict blood vessels,
Oh, yeah.
helping to control blood loss.
Oh, that's fascinating. So one hormone, ADH, can have such diverse applications in medicine. Now, before we wrap up this part of our deep dive, I want to talk about nursing considerations when we're thinking about pituitary drugs.
Right.
After all, it's our listeners who are on the front lines administering these medications and monitoring their effects. So what are some key things that they need to keep in mind?
Well, thorough patient assessment is always paramount before administering any medication, and that includes pituitary drugs, right?
Right.
Understanding that patients' medical history, including any pre-existing conditions they might have, is absolutely crucial.
Right. It's about seeing the whole patient, not just the diagnosis. Are there any specific assessments that are particularly important when it comes to these drugs?
Absolutely. So, for example, with octreotide, we'd want to monitor the patient's electrocardiogram, or
Okay.
ECG. That's because of the potential for some cardiac conduction abnormalities. And with both octreotide and somatropin, monitoring blood glucose levels is also essential, as those drugs can actually influence glucose metabolism.
Okay, so nurses need to be vigilant about those potential effects on the heart to blood sugar levels.
Yeah.
And what about vasopressin and desmopressin? What are those key monitoring points?
For those two, really careful assessment of neurological status and vital signs is critical.
Okay.
Because remember, they can impact fluid balance and blood pressure.
Right.
So we have to be alert for any signs of water intoxication or hypertension.
So it sounds like nurses need to be really on their toes with these medications. Is there anything else that they should be aware of?
Patient education is another crucial aspect of nursing care when it comes to pituitary drugs, right? It's so important to make sure patients understand how to administer their medication safely and effectively,
Right.
and to know what potential side effects to watch out for.
That's a great point. It's all about empowering patients to be active participants in their own care. Now, before we move on, let's put our knowledge to the test a little bit.
Okay,
Are you ready for some review questions?
bring it on.
Okay, so here's our first one for you and for our listeners out there. A patient is experiencing severe diarrhea, flushing, and life-threatening hypotension associated with a carcinoid crisis. Which drug will the nurse prepare to administer? Think carefully about the medications we've discussed and their specific applications.
Okay, in this case, this scenario really calls for octreotide.
Okay.
Remember, it's effective in controlling those very symptoms, those that are associated with carcinoid tumors and crises.
Okay.
So it acts as a growth hormone antagonist, helping to counteract that excessive hormone release that kind of drives those symptoms.
That's absolutely right. You nailed it. Okay. On to the next challenge. A patient is suspected of having adrenocortical insufficiency. The nurse anticipates administering which drug to aid in the diagnosis of this condition?
In this case, the nurse would likely administer cosyntropin.
Okay.
It's kind of the go-to diagnostic tool for assessing adrenal function, helping to determine if those adrenal glands are producing enough cortisol.
Correct. Again, you're on a roll. Now for a multi-select question.
Okay.
Now, this one might be a little bit trickier. The nurse is reviewing the medication list for a patient who will be starting therapy with vasopressin. Which drugs, if also ordered, would raise a concern that needs to be addressed before that patient can start the vasopressin?
Okay, so this is where understanding drug interactions becomes crucial. So a few medications come to mind that could potentially interact with vasopressin.
Yep.
First, we have norepinephrine, another vasoconstrictor.
Right?
Using both medications concurrently could lead to excessive vasoconstriction, right?
Right.
So that could put that patient at risk for some dangerously high blood pressure.
Okay.
Secondly, fludrocortisone, which is a mineralocorticoid
Right.
that can increase sodium retention and consequently fluid volume, raises a red flag, right?
Right.
Because that could exacerbate the fluid retaining effects of vasopressin, potentially leading to fluid overload.
Excellent points.
Okay.
You've correctly identified the two drugs that could pose a potential risk: norepinephrine and fludrocortisone. Okay, now for another single select question. A patient who is about to be given octreotide is also taking a diuretic, intravenous heparin, ciprofloxacin, and an opioid as needed for pain. The nurse will monitor for what possible interaction. Remember, sometimes these medications can interact in really unexpected ways.
Okay, so given that combination of medications, the nurse would be most concerned about a potential interaction between octreotide and ciprofloxacin.
Okay.
Both octreotide and ciprofloxacin have the potential to prolong the QT interval on an electrocardiogram,
Right.
and that prolongation can increase the risk of developing this really dangerous heart rhythm called torsades de pointe.
That's a crucial point for nurses to remember. You've correctly identified the interaction to be most concerned about. Okay, two more questions left in this round.
All right.
Ready for the next one?
Absolutely. Let's hear it.
Okay. When monitoring for the therapeutic effects of intranasal desmopressin in a patient who has diabetes insipidus, which assessment finding will the nurse look for as an indication that that medication therapy is successful?
Right, so for a patient with diabetes insipidus, the hallmark symptoms, right, are excessive thirst and urination.
Right.
So if desmopressin is effectively treating the condition,
Okay.
the nurse would expect to see a decrease in the patient's thirst, right?
Right.
And then a reduction in their urine output.
Right.
So these are all positive signs that the medication's really helping that body conserve water.
Absolutely. You're spot on with that answer.
Yeah.
Okay, now for our final review question in this section. It's another multi-select. Which drugs have an action similar to that of the naturally occurring antidiuretic hormone?
Well, we've already discussed two, desmopressin and vasopressin.
Okay.
They're both synthetic forms of antidiuretic hormone,
Right.
and they're used because of their ability to mimic its effects, helping the body hold on to water more effectively.
Excellent. You've correctly identified the two drugs that share a similar action with that antidiuretic hormone.
Okay, feeling pretty good about those review questions. I think we've covered some really essential points.
You did great. I'm impressed with your knowledge, but we're not done yet. We've got one more challenging question to wrap up this section of our deep dive.
Okay.
The order reads, give octreotide 50 milligram SUBQ twice a day.
Right.
The medication is available in an injectable form of 0.05 mg/L. How many milliliters will the nurse draw up for that ordered dose? Take your time. This one requires a bit of calculation.
Okay, so let's break this down step by step.
Right,
First, we need to convert those milligrams to micrograms to make sure that we're working with the same units, right?
right.
So there are 1,000 micrograms in 1 milligram. So that means that medication actually contains 50 micrograms per milliliter.
Okay.
The order is for 50 micrograms,
Right.
so the nurse will draw up 1 milliliter for that ordered dose.
Amazing. You navigated that dosage calculation with ease, demonstrating a really crucial skill for any nurse administering medications.
Yes.
It's all about paying close attention to those units and making sure everything aligns correctly.
Absolutely. Accuracy is paramount when it comes to medication administration.
Absolutely. We've covered a lot of ground today, but there's so much more to explore in this world of pituitary drugs. In the next part of our deep dive, we'll talk about those potential adverse effects of these medications, the importance of careful monitoring, and of course, that crucial role of patient education.
Looking forward to diving deeper into those aspects. Understanding those potential risks and how to mitigate them is just as important as understanding the intended benefits of these powerful drugs.
Absolutely. So stay tuned for the next part of our deep dive, where we'll continue to unravel the complexities of pituitary drugs. We really want to equip you with the knowledge you need to provide really exceptional care to your patients.
Sounds great.
I'm ready.
Okay, so let's shift our focus a little bit now to another critical aspect of nursing care when dealing with these powerful medications, and that's adverse effects. As we've been discussing, pituitary drugs, they really exert, significant influence throughout the body. So it's essential for nurses to be aware of those potential side effects and to monitor patients closely for any signs of trouble.
That makes perfect sense. We've talked about, the intended effects, but now let's kind of flip the coin and talk about those unintended consequences, those adverse effects. What are some of the common ones associated with pituitary drugs?
Well, it's important to remember that each drug has, its own unique profile in terms of those potential side effects. But we can certainly, discuss some general categories, some
Right.
specific examples, just to give you a better understanding.
That'd be great. Let's start with octreotide. What are some of the things that nurses should be watching for with this medication?
Okay, so with octreotide, some common adverse effects involve the gastrointestinal system. Okay.
So patients might experience things like diarrhea, nausea, or vomiting.
Okay.
These side effects are often related to octreotide's effects on those gut hormones.
So those tummy troubles, those are things that nurses need to be prepared to address. What about effects on other systems?
Yeah, so octreotide can also affect blood glucose levels.
Okay.
It can actually either increase or decrease blood glucose.
Oh, wow.
So careful monitoring is really crucial, especially for patients with diabetes.
Right. That's a good reminder about, individualizing care based on, that patient's medical history. What about somatropin? Any notable adverse effects with that one?
Yeah, so with somatropin, one of the primary concerns is the potential for hyperglycemia or high blood sugar.
Okay.
That's because growth hormone can have what's called a diabetogenic effect,
Okay.
meaning it can kind of oppose the action of insulin.
Okay.
So again, nurses would need to keep a close eye on those glucose readings for patients who are receiving somatropin.
Absolutely. Are there any other potential issues to watch for? Yeah, somatropin can also lead to hypothyroidism,
Okay.
which is a condition where the thyroid gland isn't producing enough thyroid hormone.
Okay.
So this might manifest as things like fatigue, weight gain,
Right.
and cold intolerance.
So it sounds like nurses need to be really adept at recognizing those sometimes subtle signs and symptoms of hypothyroidism. Okay, let's move on to those posterior pituitary drugs, vasopressin and desmopressin. What are some of those key adverse effects associated with those medications?
So both vasopressin and desmopressin can cause an increase in blood pressure,
Okay.
which is, not surprising given those vasoconstrictive properties.
Wow.
So careful blood pressure monitoring is definitely a must.
So careful blood pressure monitoring is a must. Anything else nurses should be looking out for?
Headache is another common adverse effect,
Okay.
as are some gastrointestinal disturbances like nausea, heartburn,
Right.
and abdominal cramps.
It sounds like a lot for nurses to keep in mind. Is there anything that can help them, stay organized and kind of prioritize those assessments?
Absolutely. I think it's really helpful to approach patient assessments systematically,
Okay.
focusing on those body systems that are most likely to be affected by these medications.
Yeah.
So, for example, with octreotide, the GI system and blood glucose regulation would be, top priorities.
Okay.
For somatropin, monitoring growth parameters, thyroid function, and blood glucose would be key. And then for vasopressin and desmopressin, blood pressure, neurological status, and fluid balance
Hmm.
would be those primary areas of focus.
Okay. That's a great framework, I think, for organizing those assessments.
Yeah.
Now let's talk about drug interactions. We've touched on a few already, but are there any other notable interactions that nurses should be aware of?
Yeah, there are a few important ones to highlight. So, for example, desmopressin, its effects can actually be enhanced by certain medications, like carbamazepine, which is an anticonvulsant.
Okay, so the combination could lead to a more pronounced antidiuretic effect.
Mm.
Are there any drugs that might weaken the effects of desmopressin?
Yeah. Medications like lithium, alcohol, and demeclocycline can all actually reduce those antidiuretic effects of desmopressin.
Oh, okay. That's certainly something to keep in mind.
Hmm.
What about interactions involving octreotide? Anything um, significant to note?
Yeah, one interaction that really stands out involves cyclosporine. It's an immunosuppressant that's commonly used after organ transplantation.
Right.
There have actually been case reports of transplant rejection when
Well,
octreotide was used in patients receiving cyclosporine.
wow, that's a serious interaction.
Yeah.
It highlights the importance of thoroughly reviewing that patient's medication list
Hmm.
and being aware of those potential drug interactions. Any other interactions that come to mind?
Yeah, another interaction to be aware of involves somatropin and glucocorticoids. Glucocorticoids like prednisone
Right.
can actually reduce the growth-promoting effects of somatropin.
So the combination might counteract that intended therapeutic benefit. That's really crucial information, I think, for nurses to know. What about interactions with vasopressin? Anything to be particularly vigilant about?
Yeah, so as we discussed earlier, those medications that can enhance the antidiuretic effect of vasopressin include carbamazepine
Right.
and fludrocortisone. And on the other hand, drugs like demeclocycline, norepinephrine, and lithium can actually reduce its antidiuretic effect.
Okay, so it's like this really delicate balancing act trying to, uh, you know, anticipate and manage these potential interactions. I'm sensing a theme here. Vigilance and attention to detail are so important when it comes to pituitary drugs.
You're absolutely right. These medications are really powerful tools, but they require careful handling and a
Ah.
really deep understanding of their potential effects and interactions.
I think we've done a good job of outlining some of those key nursing considerations for pituitary drugs, from assessment and monitoring to those adverse effects and drug interactions.
Right.
But there's one more really crucial piece to the puzzle that we haven't talked about yet: patient education.
You're absolutely right. Patient education is really such an integral part of nursing care,
Right.
and it's especially important when it comes to, medications with the potential for some significant side effects and interactions like
Yeah.
those pituitary drugs.
Absolutely. So let's talk about how nurses can effectively educate their patients about these medications.
Yeah.
What are some key points to emphasize?
Okay, well, the first step, I think, is to just ensure that the patient really understands the purpose of that medication,
Right.
how it works in their body.
Right.
So those clear and concise explanations using language that the patient can understand is essential.
That's a great starting point. What about the practical aspects of administration?
Yeah, nurses should provide those really detailed instructions on how to administer the medication,
Okay.
including the correct route, the dosage, the frequency,
Right.
and if that medication, requires any kind of special storage or handling,
Right.
those instructions, should be really clearly conveyed as well.
Right. And what about those pesky side effects?
Yeah.
How can nurses best equip their patients to manage those?
Yeah, it's really important to kind of discuss those potential side effects with the patient,
Right.
emphasizing which ones are common,
Right.
which ones might be more serious,
Right.
and when they need to seek medical attention.
Okay.
Providing some written information that the patient can refer to later can also be really helpful.
Absolutely. And what about drug interactions? How can nurses educate their patients about those?
Yeah, nurses should definitely advise patients to inform all healthcare providers, including their pharmacists, about all the medications they're taking, including those over-the-counter drugs and any herbal supplements.
Oh, that's a great point.
Right.
We often forget, that those over-the-counter medications, those supplements can also interact with those prescription drugs.
Mhm.
What are some other tips for effective patient education?
I think it's really important to encourage patients to ask questions
Right.
and to express any concerns that they might have.
Right.
That open communication, it really fosters a sense of trust
Right.
and empowers patients to be those active participants in their care.
Absolutely. It's all about creating that collaborative relationship between the nurse and the patient.
Absolutely. And through that collaboration, through that shared understanding of the medication and its potential effects, that's how we can really optimize those patient outcomes and ensure safe and effective medication management.
Right. Yeah. As we're wrapping up our deep dive into these pituitary drugs, I want to just emphasize the importance of continuous learning in nursing.
Oh, absolutely.
Pharmacology is constantly evolving.
Is.
There are always new discoveries and advancements, and it's so crucial for nurses to stay on top of all of that,
Right.
to provide that, best possible care.
Yeah. I completely agree. The more we understand about these medications, their mechanisms of action,
Yeah.
their potential benefits, the risks,
Right.
the better equipped we are to make those informed decisions
Right.
and really advocate for our patients.
Absolutely. It's about going beyond just, memorizing drug names and dosages. It's
Sure.
about developing a deeper understanding of how those drugs are actually working,
Yeah.
how they're interacting, and how they impact the patient as a whole.
And that understanding allows us to really personalize that care, right?
Absolutely.
Anticipate those challenges and educate our patients in a way that's really meaningful.
Exactly. So to our listeners, I encourage you to never stop learning,
Yes.
never stop questioning,
Right.
and always, always be seeking out that new knowledge. Pharmacology is vast.
Dictated.
It changes all the time. But with dedication and that thirst for knowledge,
Yes.
you can navigate those complexities
Yes.
and be those true advocates for your patients.
Well said. And remember, this knowledge that we've talked about in this deep dive, it's just the beginning.
It is.
There's always more to discover, more to learn, and more to share
Right.
with our colleagues and our patients.
So on that note, we will wrap up this deep dive into the fascinating world of pituitary drugs. We hope you found it informative, engaging, and maybe even a little bit inspiring.
Absolutely. Until next time, keep those vital signs strong
Yes?
and those minds sharp.